thank you so much for having me. Again, my name is Melanie Gwynn, and before I start, I just want to give a special shout out to Steffi Castello from the MITRE Corporation for pinging me to participate in this very important Okay. So in this presentation, I'll go sort of fast for the sake of time, but I also have my contact information listed before. So if you have any questions, just feel free to email me, and I'm happy to provide any additional information if you should need it. But we'll go over background, sort of the difference between health disparities and health outcomes along the entire spectrum of life, some really important public health frameworks and interventions that are looking to really end health disparities and improve health outcomes among communities of color, particularly Latinx community, and resources if anyone is interested in that type of information. Okay, so some key terms, we'll look at both. There's health disparity and then health outcome. You'll also hear, both if you listen to the news. According to the CDC, a health disparity is a preventable difference in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. And when we say populations, that could mean a slew of things. So that could be race, gender, SES, which we call socioeconomic status, urban, rural, sexual orientation, and the list goes on. In health services research, we often use metrics to sort of gauge health outcomes. Examples of those are hospital readmissions, mortality, or what we call death, and timeliness of care, just as a few examples. And specifically, a health outcome is a planned measurement described in the study protocol that's used to determine a change in health status as a result of interventions in participants in a clinical trial or any type of observational research, which often occurs with data in the public health sector. So when we talk about Hispanics in the U.S., there are a few important things that we just have to look at and take into consideration. So according to the CDC, 1 in 6 persons in the U.S. are Hispanic. That's about roughly 57 million people. By 2035, this will be about a quarter of the population. And according to the U.S. Census Bureau, when we look at the term Hispanic, what we're referring to are individuals that are Cuban, Mexican, Puerto Rican, Dominican, South and Central American, or other Spanish culture or origin, regardless of race. Now, this race part, this caveat is very important. It's sort of the big beauty of the Hispanic community because the Hispanic community is very diverse. It includes individuals from a diverse set of backgrounds and also races as well. And according to the Office of Minority Health, as you can see in the left-hand corner, the states with the highest Hispanic populations from largest to least are listed here, number 1 being California, number 10 being Georgia. An important aspect to point out as well is that the increase in Hispanic population is not only occurring in the urban area, but also the rural area. The reason why that is important is because as you've been paying attention to trends, some things that we're seeing are, for instance, the closure of rural hospitals. In a lot of rural areas, there isn't the infrastructure to support the Hispanic community. For example, things I can mention are access to transportation in rural areas, access to hospitals that are available, and then things like we take for granted in urban areas in terms of quality of care, having an abundance of staff members that are bilingual. These are things that are coming up more in the news, and they affect health outcomes and quality of care as individuals interact with the healthcare system. So going on the spectrum of life, I'll point out a few key disparities in health outcomes. So this is data from the National Center of Health Statistics. Most recent data from 2008 is looking at maternal mortality. So nationally, the rate is about 17.4 deaths per 100,000 live births. And so when we break that down and we consider race and ethnicity, we see that actually Hispanic women fare very well compared to their non-Hispanic white and non-Hispanic Black counterparts. And some of the reasons that we believe this happened is, of course, culture and the way that close social networks and religion play a big part in the Latino community. So things like this show up in health outcomes and in our health disparity research across the board. And then so moving along from maternal mortality or death to infant death, Sort of similar trends. So you can see here, again, this is 2018 data, so infant mortality by race and ethnicity. Hispanic women do better than their non-Hispanic Black, Native Hawaiian or Pacific Islander, American Indian or Alaskan Native counterparts. However, the death rate or infant mortality is higher than that of non-Hispanic white women and Asian women. So as you can see, there is room for progress in this area as well. And then, so now let's talk about just in general in life, what are some of the morbidity or sicknesses that we see within the Hispanic community? So this data all comes from Cigna, but compared to non-Hispanic whites, Hispanics are 51% more likely to die from diabetes, which of course is preventable. Hispanics have 24% less controlled high blood pressure. Cancer is among the leading cause of death among Hispanics, and in the next few slides, I'll show you what that looks like by gender. Hispanic adults are less likely to receive mental health treatment or counseling, and then Hispanics are more likely to experience a delay in care or unmet dental needs. There are certainly reasons behind this. Some of the major reasons that data support are access to care, access to health insurance, and then access to quality care as well. And then also there's a higher prevalence of obesity in adults within the Hispanic community. So moving along to mortality or causes of death in Hispanic women, here are the top 10 reasons. As you can see, I have highlighted the top 4 reasons, with the exception of Alzheimer's disease, are all preventable diseases. You can see cancer is number 1, as I alluded to, followed by heart disease and stroke. So compared to non-Hispanic white women, Hispanic women have higher percentages for both cancer and stroke. And then when we also look at men, we see sort of similar trends. So something I'll point out again is that all top 5 reasons when we look at men are preventable. So what this means is that things such as policy, research, prevention programming, all of these things can make a difference if we do our due diligence with research and just our overall general health care. Compared to non-Hispanic white males, Hispanic men have higher percentages for stroke and also unintentional injuries as well. So this is important. This is the ecological framework for health disparities, and the model that you see here was adopted specifically for Latino women of childbearing age, and it was used in a research study. This is important because in public health, this is a framework that is used across the board to help us understand public health and why certain health outcomes or health disparities occur, because as we all know, health does not occur in a vacuum. So just very quickly, I'll explain all of the levels, starting from individual to policy, so that you can see what components sort of make up each level, and how these interdependencies work together to impact overall health. So starting at the individual level, the factors here, they influence behaviors such as knowledge, attitudes, beliefs, and personality. Next, we have the interpersonal factors. These are interactions with other people. They can provide social support or create barriers to growth that promote healthy behavior. Next, we have institutional or organizational factors. These include rules, regulations, policies, and informal structures that can constrain and or promote healthy behavior. Next, we have community factors. These are formal or informal social norms that exist among individual groups or organizations, and they can limit or enhance overall health behavior. And then lastly, and probably most importantly, as you can see, we have policy. So those things that are highlighted here are insurance, immigration, social welfare, and payment systems. And these include state, local, and federal policies and laws that regulate or support health actions and practices for disease prevention, including early prevention, early detection, control, and management of disease. So sort of related to that, a federal agency called the National Institute of Health does a lot of research with health disparities and research as well. And they use what's called the National Institute Health Disparities Research Framework. It is heavily based on the ecological model that we just looked at in public health. But the beauty of this model is it looks at 5 domains of influence. So if you can see to your left, it might be your right, sorry. But you can see we have 5 domains. Those are biological, behavioral, the physical or built environment, socio-cultural environment, and the healthcare system. And the beauty of this model is that it not only looks at each domain of influence, but it also compares it across 4 critical levels of influence, those being individual, interpersonal, community, and societal. And again, similar to the ecological model, it looks at the interdependencies at various levels. Again, appreciating the fact that health does not happen in a vacuum. If we want to really address it, we have to look at several factors and honestly do these simultaneously to achieve the best health goals. And here you will see that I have highlighted at the bottom healthcare system. And that is important because at the end of the day, if we want the biggest bang for our buck, we have to make sure that we have the policies and the health system change that will make sure that we can ensure quality of care, access to care, and equitable care across the board. And those are things that are related to, policy and certain regulations that we have in place at the moment. So piggybacking off of this, and something that I've heard throughout the call in abundance, which is a great thing, is a lot of people have said, well, what can we do? How can we get involved? Something that everyone can do is get involved in the National Institute of Health, or NIH All of Us study. It's a program designed to collect and study data from 1 million or more people living in the U.S. for the next decade. Currently, it recruits persons from diverse backgrounds and underrepresented backgrounds. The purpose of this is to give healthcare providers the information they need so that care can be customized to account for culture, religion, and all of the things that many individuals of color will tell you are missing when we interact with the healthcare system. If you're interested in participating, the NIH study is free. You can go to joinallofus.org. The only requirements are that you be 18 years or older and also living in the U.S. So this is a great opportunity for individuals to provide their perspective, provide their medical history, and just make sure that we have the information needed as we move along in this country to make sure that our healthcare system is more inclusive of our very diverse population. And if individuals are interested in learning more, I just have some basic information here. You can go to the Pew Research Center. Of course, the Center for Disease Control and Prevention, they have a slew of data on Hispanic health. Of course, the Office of Minority Health. That office is a federal agency, and it's really big at making sure that we incorporate cultural health in all of the work that we do in terms of all of our federal programs. Cigna has a great deal of information on Hispanic health and health disparities. Also, we've talked about cancer as well. American Cancer Society has a lot of information on that as well. And then lastly, again, if anyone is interested, I encourage you to please go again to joinallofus.org and participate in that NIH study. So I will sort of in this presentation with the caveat that there are certainly many more public health frameworks and health disparities frameworks. In the interest of time, I'm just highlighting those two, the ecological and the NIH framework. If you're interested in more, please feel free to contact me. But as it was explained before, in order to reverse some of these health outcomes, we just need to make sure that we're engaging in research and that we have an active voice in